Women, listen up. This is Cervical Cancer Awareness Month, and it's time to be thinking about your yearly wellness exam. Cervical cancer is one of the few cancers that can actually be prevented. Here this morning is Dr. Ashley Lamping-Kennedy, an OB-GYN with Kelsey-Seybold Clinic, to help us out with all the important info. Welcome to Houston's Morning Show.
Thank you, Melissa.
Let's first of all talk about prevention. How do women prevent it in the first place?
So prevention can be accomplished first by the Gardasil vaccine. Now, we do recommend that starts as early as 11 years old. However, it's now approved up to 45 years old. And it's a 2-shot or 3-shot vaccine series, depending on your age. But other than that, getting your yearly exam and also getting your pap smear is very important. Pap smears are performed every 3 to 5 years, depending on your age and considering if it's normal or not. So it's very important that you do follow with your OB-GYN for your yearly exam.
And are you okay just to go get that yearly exam and not worry about any signs or symptoms, or is there something that women should be looking out for just in case in between that year?
So yes, you should always be on the lookout for any warning signs. Warning signs could include abnormal vaginal bleeding, such as bleeding during in between your cycles, also abnormal vaginal discharge. So those are things to look for. Later on, in more advanced cases of cervical cancer, you can have changes in your bowel habits. You can even have blood in your urine. So those are things also to look out for.
If anything seems off, just go get it checked. How important
Absolutely.
is early detection here? Because I feel like it can be really easy to let a year go by. The next thing you know, it's 18 months, 2 years that you might not get that checkup. But to talk about just how important early detection is and the difference it can make and truly mean the difference between life and death.
It really does. Early detection is very important. We can catch precancerous changes on pap smears, and those precancerous changes, also known as intraepithelial lesions, can be treated with, for example, burning, which is a LEEP, or a cold knife cone, which is just removing the precancerous part of the abnormal changes. So it's very preventable. If you're not up to date on your yearly exam, just make an appointment as soon as you can. We'll try to make a very comfortable environment for you. And what I like to say is we've seen it all. So please don't be ashamed if you're late on your screening. Come on in and we'll take good care of you.
I think that is such an important thing to say, that these medical professionals are there for you. And like you said, you can make it a very comfortable situation. And then anything else that you want to say as we wrap this up?
You know, just make sure that you're getting your Gardasil vaccine. Like I said, now it is approved up to 45. Ask your Ob-Gyn or your primary care provider about it. And make sure you're getting those pap smears. And it's still very important that you see your OB-GYN once a year, just for a routine visit, if nothing else.
All right, very helpful information. Thanks for taking time from Kelsey-Seybold Clinic. Stay warm over there. And everyone,
You too. Thank you so much.
Go get the